ሰላም ሰላም እንዴት ናችሁ? ውድ ተመልካቾቼ ዛሬ ይዤላችሁ የመጣሁት ባለፈው የጀመርነው የነርሲንግ ሲኦሲ ወይም ላይሰንሸር ኤግዛምን ፓርት ፎርን ይዤላችሁ መጥቻለሁ። እሱም ከ31 ጥያቄ ጀምሮ እስከ 40 ጥያቄ ያለውን መልስ ብቻ ሳይሆን ከነ ራሽናሉ ዊዝ ዲቴል ኤክስፕላኔሽን ይዤላችሁ መጥቻለሁ። እስከ መጨረሻ አብራችሁን በመሆን ዩቲዩባችንን ደግሞ ሰብስክራይብ፣ ሼር፣ ላይክ በማድረግ እንዲያርግ ብዙ ሰው ጋር እንዲደርስ አርጉ። እንጀምር።
Question 31. A 4-year-old child was brought with a cough lasting 3 days. On assessment, the nurse noted inspiratory stridor and a barking cough. What is the most likely diagnosis? The choices are croup, pneumonia, pulmonary tuberculosis, or tonsillopharyngitis. Correct answer is croup. Croup is usually viral and causes inflammation of the upper airway. The key signs are a barking cough that sounds like a seal, along with inspiratory stridor. These features set it apart from pneumonia, tuberculosis, or tonsillopharyngitis. Question 32. A child with nasal congestion, sneezing, watery eyes, and red conjunctiva was diagnosed with pertussis. Which finding best supports this diagnosis? The choices are dyspnea, rhinorrhea, low-grade fever, or whooping cough. Correct answer is whooping cough. Pertussis, also called whooping cough, is recognized by severe coughing fits followed by the classic whoop sound when the child tries to breathe in. Other symptoms like a runny nose or low fever are common in many conditions, but the whoop is the hallmark. Question 33. A 6-week-old infant had high fever, neck stiffness, bulging of the fontanelle, and a high-pitched cry. What is the most likely cause? The choices are Escherichia coli, Group B Streptococcus, Group A Streptococcus, or Staphylococcus aureus. Correct answer is Group B Streptococcus. In young infants, bacterial meningitis is most often caused by Group B Streptococcus. The combination of fever, bulging fontanelle, and high-pitched cry is very typical of meningitis rather than other infections. Question 34. A child with a femoral fracture on traction complains of severe, unpleasant sensation at the fracture site. What is the priority nursing diagnosis? The choices are acute pain, impaired mobility, activity intolerance, or impaired activities of daily living. Correct answer is acute pain. Pain control always comes first in fracture management. While impaired mobility and other issues are important, managing severe pain ensures comfort, prevents complications like shock, and promotes healing. Question 35. A 3-year-old child aspirated a coin while playing. What is the next best nursing intervention? The choices are give artificial respiration, perform the Heimlich maneuver, try to remove the coin with a finger, or refer the child urgently to the hospital. Correct answer is perform the Heimlich maneuver. When a conscious child has an airway obstruction from a foreign body, the immediate life-saving intervention is the Heimlich maneuver. Blind finger sweeps are risky and can push the object deeper. Artificial respiration is useless if the airway is blocked. Referral to hospital comes after the airway has been cleared. Question 36. A 20-day-old baby presented with feeding difficulty, convulsions, fever, and cerebrospinal fluid showing 30 white blood cells per cubic millimeter, protein 110 milligrams per deciliter, and glucose 60% of blood glucose. What is the likely diagnosis? The choices are neonatal seizure, neonatal sepsis, neonatal asphyxia, or neonatal meningitis. Correct answer is neonatal meningitis. The cerebrospinal fluid findings show increased white blood cells and protein with altered glucose levels. Combined with fever, convulsions, and feeding difficulty, these features point strongly to meningitis. Question 37. A 16-kilogram child with diabetic ketoacidosis needs fluid in the first hour. What is the most appropriate fluid to give? The choices are 160 to 320 milliliters of dextrose saline, 160 to 320 milliliters of normal saline, 160 to 320 milliliters of half-normal saline, or 160 to 320 milliliters of 5% dextrose. Correct answer is 0.9% normal saline, 160 to 320 milliliters. In diabetic ketoacidosis, children are first rehydrated with isotonic saline. The recommended amount is 10 to 20 milliliters per kilogram in the first hour. For a child weighing 16 kilograms, 10 times 16 equals 160, and 20 times 16 equals 320. Question 38. A 7-year-old child had 4 episodes over 2 days of sudden, rapid, shock-like, non-rhythmic convulsions. What is the likely diagnosis? The choices are clonic seizure, petit mal seizure, grand mal seizure, or myoclonic seizure. Correct answer is myoclonic seizure. Myoclonic seizures are brief, sudden, shock-like jerks of the muscles. They are quick, irregular, and often occur in clusters. This exactly matches the child's presentation. Question 39. A 5-kilogram child with hematocrit 25% and moderate respiratory distress requires a packed red blood cell transfusion. The donor blood has a hematocrit of 70%. What volume should be given? The choices are 160 milliliters, 182 milliliters, 198 milliliters, or 204 milliliters. Correct answer is 182 milliliters. To calculate the transfusion volume, we estimate the child's blood volume first. Blood volume in children is about 80 milliliters per kilogram. For a 5-kilogram child, that equals 400 milliliters. We want to raise the hematocrit from 25% to around 40%. Using the transfusion formula, the required volume comes out close to 180 milliliters. Therefore, the correct choice is 182 milliliters. Question 40. An adolescent girl with uncomplicated nephrotic syndrome was diagnosed. What is the most appropriate nursing intervention? The choices are prednisone, cyclosporin, cephalosporins, or cyclophosphamide. Correct answer is prednisone. Prednisone is the first-line treatment for uncomplicated nephrotic syndrome. It reduces protein in the urine and helps achieve remission. Other drugs like cyclosporin or cyclophosphamide are used only if the child does not respond to steroids.